when people first come into the practice, our goal for them is to feel welcome. So our reception area is more like a living room than it is a traditional kind of dental office space. We work really hard. Our front desk, team members are just friendly and warm and welcoming, and that means a lot to us because it's something that we want. We understand that going to the dentist is not people's favorite thing to do, and there can be some anxiety around that. Not really sure what to expect, and when you're greeted with people who are happy to see you and want to know if you're okay and what we can do to help you. That's our goal. So that's kind of the first thing that people see when they come in is just a nice, clean, welcoming environment that just is not too stressful. It's like a safe space, so to speak. How people get integrated into the practice kind of depends on what they're there for. So some folks come in because they're having pain, they're having some sort of issue, they've got a fire that needs to be put out. And our goal is to try to always help people with the thing that brought them in first, right? And sometimes it's a simple thing, sometimes it's a complex thing that's part of a larger set of problems. And so that's kind of what we try to do is help them with what brought them in to begin with. Other times people are just, hey, I moved to the area, I just need a dentist to see for just normal routine, care. And if that's the case, we do the stuff that people expect. You come in, you get an exam, you get your x-rays, we look you over, we make sure there's, no little small fires that haven't burned yet, that we need to try to help you with. Because small problems are much easier to fix than doing nothing and letting them get worse. Those have become much harder for all of us, patient and provider both. So that's kind of what to expect in terms of when you first come in. A lot of people are not used to some of the technology we have. We use 3D x-rays, we use digital impressions, we use 3D printing. For people who need crowns, we mill them on site. There's no temporaries, there's no goopy impression material, stuff like that. So that's kind of something else that, is different that people often aren't used to, but that they do see once they come in and they become patients with us.